Hello, I'm Raymond Jameson and I'm PKAVS Carers Hub Manager. I'd like to tell you a little bit more about the Hospital Link Worker role. The Hospital Link Worker works within PKAVS Carers Hub and is based within the social work discharge team at Perth Royal Infirmary and within some other rural hospitals in Perth and Kinross. One of the key aims of the Hospital Link Worker role is to identify carers early within the hospital setting so we can put in place the support that they need in order to help prevent future readmission or carer crisis. I believe that it has proven so successful within the role at Perth Royal Infirmary that it is something that we should perhaps look at rolling out within other rural hospitals within Perth and Kinross.
It can be really stressful being a carer. After I've made contact with a carer, usually in the hospital, I make an appointment to see them very often away from the hospital environment, somewhere where they can talk.
Our team's support and my support is really important to help people with mental health needs manage that transition from hospital to home. And it's often when, during this transition, it's a very difficult, very stressful time for the person with mental health needs, but also their carers and their families. And it's sometimes only when you get home that do the main carers realise they're maybe struggling a little bit more, they maybe experience a bit more carer stress than they were expecting to. And it's at this time that our focus tends to be on the patient, on our client, and it's where a referral to a Carers Link worker is really important, because they can give that kind of valuable individual approach and support to the person, to the main carer for the person's mental health needs.
It's been patently obvious that it's a very busy team with lots of diverse areas of work. I've observed having a carer worker within the team has been really supportive, not just for the referrals that we receive, but also working directly with carers who can encounter stress and anxieties in carrying out their carer roles.
Sometimes the patient may divulge some issues that are required to be identified and dealt with prior to going home, but sometimes through speaking to family members that can bring up some issues as well, and a lot of the time that happens around when we're talking about discharge planning. So barriers may be put up by patients themselves or their family members, and that's at that point that I would contact the Carers Link worker to help support that process.
Sometimes carers are looking for information, and very often I'm able to put them in contact with services that they need. But mostly carers tell me that what they appreciate the most is somebody that they can talk to and somebody that they can chat their circumstances over with, and this is the thing that makes all the difference to them.
We often come across older people who have family members, friends that care for them, but aren't recognised as such. They're often under lots of stress, and we have a really good link with our link worker and can refer them quite easily, quite informally, and we often get very good feedback about what's happened with the patients and their carers.
Certainly the evidence that we've received from the carers who have accessed the Hospital Link Worker for support proves that it has made a big difference in helping them access the support they need now and in the future to help with their caring role.